Hello everyone, my name is Esther Herlock. I'm going to be talking to you about a new diagnostic test that I developed for identifying Misty River disease. Misty River disease has recently been discovered with a current prevalence of 14% based on the latest study. There is only one test available at the moment to identify Misty River disease. This test requires imaging using intravenous dye. In an effort to develop a less expensive, simple, and quick test for initial diagnosis, I have developed a new test called the MR smear. This test is relatively painless and only requires a quick prick of the finger for a sample of blood and is tested similarly to how blood glucose levels are tested. The latest study I conducted involved a population-based sample of 10,000 people using this new diagnostic test. I would like to discuss those results with you and recommend guidance when speaking to patients about the test results. According to the study, the sensitivity of the test was 91%. This means that this test has a high probability of identifying those who actually have Misty River disease. However, looking at the specificity, we see that it was only 15.8%. This means that there is a high chance of false positives using this test. The positive predictive value tells us the probability someone has the disease given they tested positive for it. Since the positive predictive value of this test is only 15%, we know that there is a fairly low probability that testing positive means someone actually has a disease. The negative predictive value tells us the probability someone does not have the disease given they tested negative for it. Since the negative predictive value of this test is 92%, we know that there is a high probability those without the disease will test negative. The recommendations I have for you based on these results is to use this diagnostic test as your first step in identifying positive cases and ruling out negative ones. Although this test has a high probability of ruling out negative cases, there is still the possibility of false negatives. It is important to be transparent with patients about this and share the statistics with them. For those patients who receive positive test results, it is recommended that they are sent for further testing using the imaging and intravenous dye method. Explain to the patients that the results from the study suggest there is a high false positive rate and their diagnosis should be confirmed prior to receiving treatment. Going forward, there will be a continuation of studies performed to gain better visualization of the accuracy of this test. With Misty River disease being newly discovered, testing is likely to improve over time. I ask that you do your best in your documentation of results from your clinics for those who test positive or negative and are confirmed positive or negative. The availability of the information through the collection of data over years is beneficial to the assessment of the diagnostic tests and the prevalence of Misty River disease in this population. If you have any further questions or want to offer suggestions, please reach out to me personally. I am happy to further discuss results from the study. Thank you all for your time.